Hello, my little shinigamis. So, long time no see. This is gonna be a story time finally, but it's not gonna be the ones I promised you. Those are gonna be done next week or the next few days, depends. It's been a crazy year, crazy month. I've been working a lot. I had to shower, so I'm on the hair, but yeah, let's get started. So, this story time is gonna be my first surgery. So, the beginning of March of 2018, I started getting really bad stomach cramps to the point, like, the ones you get when you gotta drop everything and run to the bathroom and go. So I will be getting those pains every now and then. I thought, oh, okay, it's probably just because I don't have a good diet. Maybe it's because, I'm getting older, it's getting worse because I've had constipation issues since I was a little kid. So I thought, oh, okay, it's probably just getting worse with age. So, age. So I would take Alka-Seltzer, Pepto-Bismol, Tums, whatever. It gets rid of the stomach ache over the counter. So I didn't think much of it. So I would say a few months after, I would say the beginning of July, I started, like, the pain would go from like a 3 to gradually to a 7, like the pain in my stomach. And, it was pretty much going like around my belly button and on the right hand side. So I thought, why is it getting like that? So, excuse me, I went to the clinic and they diagnosed me with some kind of a gastro thing where, I gotta eat plain chicken, eat rice, drink water for the next few days, see if that helps. And they gave me painkillers for it, but it didn't work. So, I decided to let it go. Maybe it'll heal on its own and shit. So, one day I was with my boyfriend. I was with my beloved. We were on a date, pretty much going to the movies, and those speed bumps that you go over. So we went over one, and I immediately got this sharp pain in my stomach. So I was like, "Ow!" I was like, "What's wrong?" So then I told him everything, and we continued our day. He's like, "Do you want to go home?" I said, "No, no, no. I want to continue going on your day because that's my man. I don't want to fucking leave his side. I didn't want to ruin the date." So we went, and we went to Dave and Buster's, and I ordered fettuccine alfredo. It's my favorite because it's really good. It's to die for, yummy, and I couldn't finish the whole thing. Like, I had no appetite. Everything hurt. Like, it was just bad. So, pretty much next few weeks after, it was around, what did I say? July. Yeah, July, not weeks, months. So around October, the beginning of October, the pain started turning to heartburn, to where, like, I was getting a lot of heartburn, like right here in my esophagus, to where, I had to literally chew Tums. I was Pepto Bismol, I was drinking ginger ale. Nothing helped, and I wasn't eating any spicy foods, and my appetite was not pretty much good. I was like eating one meal a day or 2 meals a day, very light meals, like, like very little things. I would get full immediately. Like, even if it was like a little cup of yogurt, I'd be full. It was like, what's going on here? Why am I not wanting to eat anything, and why am I getting so full? So, excuse me, October 31st, Halloween, my favorite holiday. So I, excuse me, I finally saw my primary doctor, and she told me to go to the hospital because it could be appendicitis. So the symptoms she was telling me, they matched the ones how I was feeling. I thought, oh, okay, stupid me. This whole time it was appendicitis. How the hell am I still alive? Because, appendicitis is only 48 hours until you die. Well, until it gets worse. So I thought, but she told me that there, in rare cases, you get symptoms a few months before, a few days until it's time to get it removed. So I thought, oh, okay, cool. You're the doctor. I'm listening to you. You're the boss. You know everything. You went to school. So I did not go to the doctor on Halloween. I wanted to celebrate it, go trick or treating and shit. So November 1st, I decided to go to the doctor. I took myself there, and they gave me a CT scan, and they told me that I had tiny cysts like this right there on my stomach and on near my ovaries. So I thought, oh, okay, because it's hereditary. My grandmother had it on my mom's side. And my sibling, a sibling of mine had it. So I thought, oh, okay, it's probably just hereditary. They survived it. I can too. Bless me. Okay, so excuse me. So they pretty much told me about the cyst, like I had them on my stomach and everything. So, hey, Butters. So I so anyway, I left they told me I can't talk today, so they told me to go see my primary doctor for a second opinion. So I went to my primary doctor, and she told me to go get an ultrasound. So I went there January. So it was 2019. So I went there in January, and the girl who did the ultrasound, very sweet girl. She, like, I remember the look on her face. She took pictures, because they take pictures of your stomach and everything. Her face went like this to the screen, and I'm like, is there something wrong? Oh, no, everything's okay. Everything's okay. So she left immediately, and mind you, the results from ultrasounds usually take a few days, a week. So she comes back. She's like, okay, I'm gonna show my specialist these. He's in today. I said, okay, and I thought, oh, okay, I guess, hey, special day for me. They're here, so I can get my results the same day. I didn't know that was possible. So she comes back. She tells me, we recommend you to go to the hospital. I'm like, why? She's like, oh, we can't tell you. I said, can you please tell me? I have anxiety. It's not cool not telling me to get me nervous. Okay. Your masses are like this. I'm like, oh. She's like, yeah, just go to the hospital just to be safe. In other words, they wanted to save their asses. I said, okay. So my mom and I go have Chinese because I was hungry. We went to her doctor's appointment for bloods, and then we went to the hospital. And I had another CAT scan, and they sent me to a hospital. So I went to a different hospital because that's the hospital because they had no more beds for me to go stay in, to be in the room with. So there were no more rooms available in the hospital where I was at. So I went to a different hospital, which is a good hospital. And he told me that they're jelly like, they look like jelly like cysts. And he told me to go see a specialist. And again, my doctor referred me to a specialist. It's called an oncologist for cancer. So, wait, no, not oncologist. So sorry. What do you call the gynecologist? Thank you. So, one who does for the babies and everything. So anyway, I went to him, and yeah, they gave me a DVD to give to him so he can look at the masses, and he told me, oh, okay, you need to go see an oncologist. So I'm like, what does that mean? Because he told me straight out, they might be cancerous. So I cried, I was nervous and stuff, because I thought it was karma. I believe in karma. So I was afraid for my life. I was probably gonna, hopefully, God forbid, I was gonna lose my life. Why did I say hopefully? I mean, God forbid, I was afraid I was gonna lose my life. So excuse me. And so I went, and he was a nice doctor, and he told me, from the looks of things, and he told me that they would have to be surgically removed. So I said, yes, whatever you say, And I forgot to mention, I went a third time to the hospital for the same thing to get into the CAT scan. So anyway, he scheduled my surgery for April 17, 2018. So I was very nervous. The last few months I was nervous. My man was pretty much supportive. My folks were supportive. My siblings. So I was nervous and everything. So the night before April 17th, they had to have me. I had to have my heart checked. EKG to make sure I'm okay for surgery. I had to get blood work. Excuse me. I had to get what else? I had to get more tests before to make sure I'm okay. So then April 17th. My surgery was scheduled for April 17th, and I forgot to mention the oncologist who told me about surgery. He was doing my surgery, and he hooked us up because I was able to go to the different hospital to get my surgery. He hooked me up with that, so awesome. So anyway, April 17th, before the night before, I had to go talk to the specialist, and they were telling me how it's gonna work out, all this other stuff. So April 17th, I wake up. Well, that night, I couldn't sleep for shit. I was nervous, my first surgery, I was afraid and stuff. So, I prayed, because, I believe in God, Lord Jesus Christ, amen. I'm a Christian, And, what was I going to say? Oh, so, before I go on my surgery, when I went to the hospital the last time, they tried telling me to go to a hospital that's known for having patients die there. I'm like, I'm not going to go to that hospital. I mean, why the hell should I? Like, well, they're available for bed. I said, I don't care. I'm not going to that hospital, So anyway, after that, so back to my surgery story. So April 17th, it was noon. So we had to get there around 10. To check in. I had to dress. I had to pretty much. They gave you these wipes to wipe yourself off and everything. Just to to cleanse yourself. So my mom was there. My stepdad was there, so I was pretty much I was all ready and stuff. So they had to put this needle in my hand right here, like right there for the IV. So they did that, which hurt like a bitch, but I was okay. The nurses were very nice to me. They were telling me, it's gonna be fine. They were just talking about personal life and about their daughters and stuff like that. So they come with the bed till we went to surgery. I kiss my folks. See you again. Kiss you. So and the nurse, Mara, I'll say her name, very sweet lady, she was talking with me, calling me sweetie, chatting with me, making me feel better, talking about how she has children, a granddaughter, so we were just talking, and then finally, because they let my mom walk me to the end, before surgery, but the door before surgery, they let my mom walk me there, and, she kissed me, and I remember going inside, I see the doctors and nurses counting the instruments, because, they gotta do that, it's just in case one were to get, because there are stories about them losing instruments instead of patients' bodies, so they were counting them, and I saw this robotic machine, I was getting nervous, so I said out loud, because, I guess I couldn't hold it in, my anxiety, and I was like, oh, I'm so nervous, and one of the nurses turned to me, smiled, and said, don't worry, we'll take good care of you, so that made me feel better, and I remember they were moving me from the gurney, well, not the gurney, the wheelie bed to the surgery table. So they strapped me down, and everything. They asked me if I was comfortable. I said yes, and then they put this white liquid that's in the IV. I guess that's what calms you down. Yeah, it's what calms you down. So they put that, and I felt a little bit sleepy, but then and then anesthesiologist, I remember him putting the mask over my face, and I dozed off within the next 1 minute or two, and then I woke up. To the nurse, very sweet lady, saying, I'm not gonna say my name, Miss So and So, wake up, surgery's over, you're in recovery, and she was putting on my gown over me, So I literally woke up and I was like, am I in Vegas? And she played along, yes, you are in Vegas, sweetie, you won. I'm like, oh, good, good. So now I was out of it, and I had oxygen on my face, and there was other people in recovery, So I was pretty much out of it. And there was a guy there recovering saying, "Hey, we all made it." I said, "Yeah, we made it." He's like, "Good talking to you." I said, "You too," So anyway, and I don't remember being wheeled into my room. So the surgeon called my mom and my stepdad, and they rushed to me in the room. I don't remember much, but I remember them. After that, I remember them, pretty much laying me down. Oh, before I go on, I forgot to mention when I woke up. She told me, be careful, there's a catheter inside of you. And I was like, oh, shit. Because, I felt violated. A catheter is what they put inside of you in your pee tube, because with the surgery, I was too swollen. I couldn't pee or do anything on my own. So that was inside. I felt violated. I'm like, she's like, you just don't move. I'm like, okay. I was like, oh, shit. So anyway, they wheeled me into my bed, to my room. And luckily, I had the room to myself. So the nurses were telling me, they lifted up my shirt, the gown, and showed me that I had a drain right here. I had a drainage to collect the blood and everything that they needed to drain whenever it got full. I had 34 staples on my belly, and I had a few other tubes just for drainage and all that stuff, and the catheter. So I was put in my room. The food was delicious, and the doctor came and spoke to me. It was hard to pass a stool for the next few days, but they told me to drink a lot of prune juice, so I was drinking prune juice, And finally I was able to pass a stool, which hurt like a bitch. The pain was so bad. And then the night after my surgery, the same night as my surgery, but hours later after surgery, the pain didn't, they asked me too, are you in pain? I said no, but then, I would say around 11 p.m., the pain got to me from surgery, it felt like somebody had it felt like somebody had a razor doused with alcohol and was scratching the inside of my belly. It hurt so bad that I cried, and my pain was immediately at 12. So they gave me IV and everything. The pain went away. They let my mom stay the night with me. Well, whatever she wanted. So she stayed a few nights with me and my mom. So they let her. And from then on, I recovered. They were telling me how, thank the Lord, that my masses were borderline which means they were not cancers, but they told me to get a second opinion. So I've been. What else I want to say? Well, I forgot something. I'll get to that anyway. So they were borderline, and it was a laparoscopic surgery, and it's where they cut you a little bit and they use the robot just to pretty much do your surgery, and the recovery process is faster. You know, you don't really have a scar. Well, I have a scar. I'll show you it. That's my scar from surgery. And excuse me. So I left the hospital. You know, I was able to go home and shit. You know, I was able to recover. You know, 2 years later, here I am, still here. So anyway, my surgeon told me that there was 5 masses in my stomach, the size of bigger than my fist. 5 masses in my stomach. They removed. They unfortunately had to take out one ovary, but thank the Lord, I have one ovary inside, so I'm still able to bear children someday. Every 6 months, I gotta get ultrasound to make sure. I'm gonna get to that. Sorry. So anyway, after that, I went home, recovered. Like I said, I got to see the doctor every 6 months for ultrasounds because apparently my one and only ovary has tiny cysts, and thank the Lord again, they have not grown, so I'm still okay to have children because I have one ovary left. And after a few weeks after, I was able to get my stitches removed. Oh, let me tell you something. The way, because you know, after you leave, they took off a drain, which that hurt when they pulled it out. It was like a lot of pressure, so they stapled me up, they sewed me shut, they taped me shut. So, um, they pretty much, what did they say? Oh, so I wasn't able to bathe or anything, which was uncomfortable. I hated not being able to bathe. You know, I had to lay on my back. They told me I had to go commando, so I'm like, oh man. So, um, what was I gonna say? Yeah, so my one and only ovary is okay. You know, I'm still gonna have children. So 2 years later, here I am. Well, 1 year later, you know, here. I am. You know, I'm recovering. I'm happy. I'm still able to have children. But I'm gonna put my video in the description of me in the hospital. So, but the symptoms, ladies, you gotta look for is weight gain. Well, not weight gain, but bloating into the stomach, constipation, heartburn, diarrhea. Like if you have those symptoms and you don't eat, and you know you don't have a reason for to have that, go see your doctor and get checked because whatever, I don't know the name of what it was called, but you know what I had, it's something no one should go through. You know, get it checked. You know, get early like I could because God forbid it could lead to bad stuff. And yeah, I have nothing else to say, and I apologize if I stuttered or I skipped through. But yeah, that's a story time. My first surgery. Thanks for watching. See you guys. Bye.